And thank you for joining us today. Welcome, everybody. And I love seeing the connections when we have women here from all over the world. I said this the other day, but we have Beirut, we have Geneva, we have Lausanne, we have, of course, the US, and we have Germany. Love it. Haleb, thank you for joining us. Love it, love it. And France, right? I forgot France. Thank you for joining us. Please connect, and this is all about connecting, exchange cards. Join us, join our Instagram page, Armenia International Women's Association. At this point, before we get started, I'd like to say that if you have any questions for the speakers or the moderator today, please join our WhatsApp community. The information is just here. At this point, I just would like to get us started because we're already, 10 minutes late, Silva? But we'll try to be on track. Anyway, okay, for our first panel today, it's about health for every woman, a holistic approach to women's health and wellness in Armenia. I would like to invite our moderator for today, who's an internist and pediatrician, Lorky Libaridian. Join us. She is also connected with COAF, Director Community Health Programs, and she is a program director at PrEP Pediatric Residency Program. Our next speaker is a dear friend of the family. She's a gender specialist and global head of partnership at SafeYOU, Natalie Marcarian. Next, I'd like to invite founder and CEO of Michel Audent Mother Center Armenia, Astrik Vardanyan. And next, I'd like to invite program director at Alzheimer's Care Armenia, Ofelya Kamavosyan. Thank you. And last but not least, pediatrician and chief expert coordinator at VIVA Foundation, Edlen Bah. Thank you, everybody. Lorky, it's all yours.
Thanks so much, and thanks everyone for being here. I guess what is relatively early. I'm glad to hear that things have been going well so far. So I'm very happy to bring this, I didn't bring them together, but to be up here on stage with them, so thanks to the organizing committee as well. I already got my introductions, but I think what's most interesting here is what everybody here on stage does. So what we've discussed here as a team is that everybody here will take a couple of minutes, maybe 2 to 3 minutes, to introduce themselves, their organization, and their work in the scope of women's health and wellness. So some of these organizations do work more than just outside of women's health, but we've asked that they introduce their organization, their work for a couple of minutes, and then we have some questions that we'll discuss, and we'll take some questions as well. So hopefully this will be interesting and informative, and you'll walk away from here with some really interesting questions and self-reflection as well. So I think we can just go down the line this way, if that's okay. And don't forget to turn on your speakers.
Okay, good afternoon. My name is Edlen. I'm a pediatrician and coordinator of Motherhood and Childhood Program in VIVA Charitable Foundation. Foundation has over 60 programs in medical, educational, and social areas. And in the field of women's health, in 2018, a prenatal screening center was opened in Gyumri. So pregnant women in Shirak region are able to get free examinations, and during 1 year, 2,000 pregnant women were already examined. Doctors from that center were sent for trainings. So, and for the kids, 90% of kids who are applying to the foundation with retinoblastoma, which is eye disease, are sent to Moscow to get treatment. And in 2023, when the forced resettlement started, Volunteers and doctors of foundation were in Goris and Vaik, and during 1 week we gave medical and social support to 70,000 people. And there were pregnant women also there. So the foundation was monitoring the situation with pregnant women during the blockade, and the stress and difficulties that they were going through was showing that there will be problems during delivery. And within the project Motherhood and Childhood project, we launched on 4th November 2023, we launched a program to support this more vulnerable group, pregnant women. And we decided to help them with first necessary things for newborns, which were diapers, clothes, beds, trolleys, bath tubes, and also pregnant women in the project. They received medical help, consultations of gynecologists, endocrinologists, and newborns were receiving consultations from pediatrics. Me and my colleagues were consulting there, and till now we are in touch with them. So during these 8 months of the project, where we were working with the pregnant woman, we saw a lot of problems. Like every second woman in the project is delivering through CS, and explanations are so different and not acceptable from the medical side. And the sad thing for pediatricians is that every second newborn is receiving formula, which is also not acceptable. And explanations why they are receiving formula is not actually acceptable for pediatrics. And this is a very sad situation, and the solution that we see is to educate girls. We need to educate them from the school. They have to know their rights. They have to know that they have the right to discuss with the doctor the plan of the delivery, and they have the right to decide how to feed the child. And we have to educate. We need more programs to promote breastfeeding, and so these are the problems that we face, and how we can get help. The help can be financial, it can be through like charity programs, it can be through we need experts to come and to share with their experience. Of course, we need to train the doctors, and of course, we need more volunteers. And it will be nice if the expert will come here, will share with experience, and of course will stay with us here in Armenia.
Thank you so much. I'm going to ask you to turn your speaker off just so they don't. Thank you.
Thanks, Lorky. Thanks, Edlen. Hi, everyone. Good morning. Thank you for making it this early for this panel. I'm Natalie Marcarian. I'm the head of partnerships and the gender specialist at SafeYOU. I think a few of you probably know what SafeYOU does, but I'll explain how organization and our technology works again for you. So SafeYOU was created in 2020 by Mariam Torosyan as an innovative technical solution to violence against women. So I won't go through the statistics in too much detail because I know that we're all well aware of the problem. 1 in 3 women worldwide experience some form of sexual or physical violence in their lifetime. About 50,000 women and girls a year are killed by someone they know and that they trust globally, and the statistics are very similar in Armenia. So what we created is a mobile application for women and girls and also a web platform for stakeholders. So the mobile app works in 3 different ways. The first is an emergency help function. So we allow women and girls to pre-select up to 7 contacts that they want to alert in case of an emergency situation. These can be 3 of their family and friends, 3 of their service providers that we've onboarded onto the app for them, so NGOs, individual professionals, and then they can choose if they want to alert the police in an emergency. When they're in danger, they press and hold on an emergency button inside the app for 3 seconds, and a free alert is sent to all of those contacts, and the app also starts audio recording your surroundings for later legal proof. The app also contains a network which shows you a consolidated database of all relevant organizations, resources in your area that work to defend, support, and empower women. So in Armenia, SafeYOU partners with every women's NGO in the country across all regions, and we onboard their information into the SafeYOU network. And from there, women can directly message them, find their contact details, where they are located, and what kind of services that they provide. Lastly, and one of the most important functions of the SafeYOU mobile app is the forum. So it's here that we onboard professionals, psychologists, lawyers, social workers, gynecologists, and also NGOs that can open up a forum to offer free consultations to women and girls through the app. So often women face geographic and financial barriers to seeking this kind of help. So they can download SafeYOU for free and talk to these professionals through our forum section. They can talk anonymously, they can set a nickname for themselves within the app, and they can also talk peer-to-peer, so discuss their issues with their fellow community, understand that a lot of the issues that they're facing aren't specific to them, and then seek advice. And then we've also created a web platform, so a platform for stakeholders, so for NGOs, government officials, police, all other organizations and entities working in this field to be able to manage cases in emergencies, also create educational content and share it through the app. And most importantly, they have access to a data analysis system. So as we'll get into later, one of the key issues in women's health and specifically with gender-based violence is a lack of data. Women obviously a lot of times don't feel comfortable reporting these cases. And so SafeYOU's created an AI-based data analysis system which works to collect non-personally identifiable data. We analyze it, and then we create policy recommendations that we can give to governments and to other stakeholders in the field to inform their policies and their programs. I'm almost done, I promise. SafeYOU is currently live in Armenia, Georgia, and Iraq. It was created here in Armenia, but we're expanding. Our team is currently in Romania, launching the app there as well, which is very exciting. Our first entry into an EU country. We have 35,000 users, a little bit more than that now, across these 3 countries. Most of them are actually in Georgia. In Armenia, we have about 6,000 or 7,000, but I'll also expand on that a little later. And yeah, Armenian women we find are really engaging in the forums and with the idea as a whole. So I will end it there for now. Thank you, everyone. And yeah, looking forward to discussing more.
Բարի լույս բոլորին, ես հայերեն եմ խոսելու, շնորհակալ եմ բժիշկ Լորկին ներկայացնելու համար եւ բոլորին, որ Կիրակի առավոտյան այստեղ եք։ Ես ներկայացնում եմ Alzheimer-ի խնամք Հայաստան կազմակերպությունը։ Այս կազմակերպությունը հիմնել է Ամերիկահայ ծերաբույժ դոկտոր Ջեյն Մահաքյանը, որ 30 տարի եւ ավելի Ամերիկայի Միացյալ Նահանգներում զբաղվում է այս խնդրով։ Երբ 5 տարի առաջ առաջին անգամ, ոչ առաջին անգամ, բայց երբ 5 տարի առաջ նա Հայաստանում էր, զարմանքով նկատեց, որ մեր երկրում տարեցների համար նախատեսված ծառայություններ եւ ծրագրեր չկան։ Եվ դա այն մեկնարկային կետն էր, որից մենք սկսեցինք, եւ տարբեր լսարաններում ես խոսում եմ այս թեմայով, որպեսզի հատկապես հայկական հասարակությանը ֆիքսեմ եւ կարեւորեմ, միշտ ասում եմ, որ այն ծրագրերը, որ այսօր մենք իրականացնում ենք, այնքան ոչ այնքան տարեցների համար են, որքան հենց մեզ համար են, որովհետեւ մենք սովոր ենք տեսնել արտասահմանից եկած առողջ, ակտիվ տատիկ պապիկների, բայց մեր երկրում կա կարծրատիպային նաև մոտեցում ստիգմայի պես, որ դե 60 ես եւ կա այս երևույթը, եւ մենք սկսեցինք տարբեր ծրագրեր իրականացնել Հայաստանում։ Ես ուզում եմ դրանց մասին պատմել, որ բոլորը տեղյակ լինեն։ Առաջինը դա առաջիններից ոնց կուզեմ նշել, դա հիշողության սրճարաններն են, որ մենք հիմնել ենք Երևանում եւ Գյումրիում, Լոֆթի հետ, որտեղ 60 եւ ավելի տարեկան մարդիկ գալիս են, կոգնիտիվ խթանման վարժանքներ են կատարում, սոցիալական կապեր են հաստատում։ Մյուս ծրագրի մասին դուք վստահ եմ լսել եք, դա Ռոբին ռոբոտներ, որ Նորքի տուն ինտերնատում կովիդի ծանր օրերին տատիկ պապիկներին զվարճացրեց եւ մենք երբ որ հիշողության գնահատում կատարեցինք, տարեց այս մարդկանց, մենք տեսանք, որ այն մարդիկ, ովքեր շփվել էին Ռոբինի հետ, օգտվել էին, այսպես ասենք, նրա ծառայություններից, ընկերակցությունից, շատ ավելի լավ կոգնիտիվ վիճակում էին հիշողությունը, տրամադրությունը, քան նրանք, որ չէին շփվել։ Եվ այս ծրագրին հաջորդեց մեր շատ սերտ համագործակցությունը պետական կառույցների հետ, առողջապահության նախարարության, աշխատանքի եւ սոցիալական հարցերի նախարարությունների հետ համատեղ ծրագրերից մեկն այն էր, որ մենք առաջին անգամ Հայաստանում մշակեցինք փաստաթուղթ, պետական փաստաթուղթ նախարարի հրաման դեմենցիայի կանխարգելման ազգային ծրագիր։ Ես հպարտությամբ ուզում եմ նշել, որ երեք նախարարը, երբ որ հաջողված ծրագրերի մասին են խոսում կանանց համար, նա նշեց հենց այն ծրագիրը, որի ակունքներում կանգնած է հենց մեր կազմակերպությունը, առողջ ծերության ակումբները։ Եվ այսօր Հայաստանում հայ կանայք նաև 60-ից բարձր Երևանում կարող են անվճար այցելել այս ակումբները, որոնք գործում են Երևանի այս պահին 10 դպրոցներում, հիմա էլ ընթացքի մեջ են եւ ես ներկա գտնվողներին կառաջարկեմ, որ իրենց հարազատներին կամ հարևաններին, որ գիտեք 60 եւ ավելի տարեկան եւ տանը ձանձրանում են, անպայման թող այցելեն։ Մեր մի այսպես հետաքրքիր բան ասեմ, մեր հանդիպումների ժամանակ դոկտոր Ջենի հիմնականում ԱՄՆ-ում է լինում, նա մի նախադասություն ունի, ասում է Օֆելիա, ես գաղափար ունեմ, ու ես արդեն գիտեմ, որ այդ գաղափար ունեմը վերածվել է ծրագրի, որտեղ մենք մեր տեղական թիմով դա իրականացնելու ենք։ Անցած գաղափարը, որ դարձել է այսօր արդեն ծրագիր, դա դասընթացներ ոստիկանության համար, որովհետև Հայաստանում ոստիկանությունն էլ որևէ կերպ տեղյակ չէ, թե ինչպես պետք է վարվի տարեց անձանց հետ եւ եթե լսել եք ոստիկանական այդ տեղեկագրերի մեջ անդադ նրանք որոնվում են, բայց նրանք չեն որոնվի, եթե մենք կարողանանք շուտ իմանալ, ընտանիքներն իմանան այդ մասին եւ էլի պատկերավոր օրինակ բերեմ, երբ որ փողոցում մենք տեսնենք Երևանի փողոցում 3-4 տարեկան երեխա, բոլորս ներառյալ ոստիկանները ձեռքը կբեռնենք եւ կհարցնենք հարազատին, բայց թափառող տարեցին չենք ճանաչում եւ չենք մոտենա, չենք տեր կանգնի։ Սա է, որ էլի պիտի ձեռքը բռնել եւ տանել հարազատին։ Մեր այս պահին ընթացիկ ծրագրերից մեկն էլ Ռոբին ոստիկանության համար ծրագրերն են եւ տարեց տարի մեր ծրագրերը անընդհատ են, լուրջ աշխատանք է կատարվում նաեւ ընտանիքի անդամների հետ, որովհետեւ իրենք չեն ճանաչում հիվանդությունը եւ չգիտեն, որ դա հիվանդությունն է, այսինքն դեմենցիան է եւ կարող են ընտանիքի անդամին չհասկանալ, նեղանալ, բայց երբ որ մենք սկսում ենք իրենց հետ աշխատել, իրենք իրենց մենակ չեն զգում եւ գիտեն, որ լուծումներ կան։ Շնորհակալություն, մյուս հարցերի մասին դեռ կխոսենք։ Շնորհակալ եմ։
Good morning. My name is Astrik Vardanyan and I represent the Michel Oden Mother Center, or as we short say it, the Mom Center. Michel Oden is a French obstetrician, a very well-known French obstetrician who basically revolutionized birth around the world, especially in Europe. And we proudly named our organization after him. Michel Oden came to Armenia in 2022 when we first started our organization. And I would like to start my talk with his famous quote, "To change the world, we need to change the way babies are coming to this world." I have to tell you my personal story. In 2018, as an anthropologist and a researcher and a doula, I came to Armenia to make a documentary on childbirth. I partnered with this incredible filmmaker, Natalie Marcarian, and together we interviewed dozens of mothers and doctors. And what was emerging was truly a saddening picture, not something that I really wanted to tell. You know, that wasn't the film that was turning out the way I wanted. That wasn't the reality that I wanted for my native country. So I did not have a heart to go to post-production. And at that moment, sitting with my team, I made a pledge to dedicate my life to the betterment of the Armenian women's birth and maternity care in general. So together with like-minded people from the local experts and the global experts and diaspora colleagues, we created the Mom Center with a name to make the maternity care evidence-based, respectful, and safe. We decided that we have to really put our energy in this most radical public health issue to better the obstetric ecosystem in Armenia. And so the Mom Center was established mostly by volunteers and with a fantastic team from Michelle Odom as an advisor, an expert in childbirth, perhaps the biggest name in the field of women's advocacy, childbirth advocacy, and local experts like Garine Saribekyan, Hasmik Lalayan, Susanna Harutyunyan, people that have done tremendous amount of work already on the field. And what is unique about the Mom Center is the multidisciplinary, the holistic approach. We're comprised of doctors, midwives, psychologists, yoga teachers, nutritionists, anthropologists, doulas. So this is a very comprehensive way of treating the issue at hand. We also decided that we're not just going to work with the mothers, we're going to educate the doctors as well, and we're going to work very closely with the system, with the administration. To change the system, we had to become the system. We had to go within the system, acknowledge the issues, and start working on it. We have number of services. We have services for the mothers, childbirth preparation classes, breastfeeding education and support. We have perinatal psychology classes and group sessions. We have child psychology classes from forcibly displaced people from Artsakh. We just started our Hayrikneri Akum, Daddy's Club. For the first time, we started this new program partnering with the UNFPA. We created, well, I'll save this. There is a discussion about the most proud projects, and I'll save this for future. But what I want to say that I truly, I get very emotional about this topic because I truly dedicated my whole time almost. I work overtime. I go back and forth to LA where my kids are, and I come here mostly the majority of time throughout the year I'm here. And so I go back and forth. But when I'm there, I work 2 shifts, and I totally feel this very, very much big satisfaction from this work. I think this is God's work, and I really want to ask every one of you to check out the Mom Center AM on Facebook and Instagram, and momcenter.am, our website, to see all the wonderful programs. You could start getting those services. If you live here, they're all free, and or you could engage in many different ways. You could advise us, be a speaker, or just support other ways. We have partnership with the NIH of Armenia. We have created wonderful 2-year program for doctors to train in a new way, in a very revolutionary way, to treat women in the birthing room. We call it Mother, Baby, and Family-Friendly Hospital Environment, Hospital Initiative, and we call this series Gentle Birth series. So we have 60 speakers from around the world. Half of them are, experts from the US and Europe and elsewhere, and half of them are from Russia and Armenia. There is a pioneering work happening here, and I really want you to be part of it. Thank you.
Thank you, everyone. As you can tell, these are some really, really impressive programs, and AIWA has really brought together not just the standard topics that are discussed, but very things that maybe you haven't heard about before. There are a couple of themes that come out in everyone's kind of short presentations, and I wish we had time for you to hear about all of the work that they do, but I'm going to kind of give us a window into their work by asking a couple of pointed questions on these themes. One of these themes is integrated care. I think we heard that in a number of, from our first and fourth groups, especially, and I will also say that Viva and Goris was the only group down there thinking about the menstruating women, the pregnant women, the diapers. It was the only group down there, so I really want to highlight that as well as when we're thinking about integrated care. The second theme is that we're hearing about organizations and projects that think not just about an individual, but then how do we learn about that project and turn it into policy so that it is something that is reproducible, more impactful, and sustainable. And the third is, how do we know that we're effective? And all of our speakers started touching a little bit about data. So those of you who know me know that I love data. I'm a big fan of data. And so we're going to start with that point first. And again, we touched on it a little bit, and for whoever wants to and feels comfortable and is as excited about data as I am, I'd love to know, how did your organization or your group know that there was a problem? How did you know that it was there data? Was there no data? And how did you approach that? And I'm going to leave it very open because there's a lot of different directions it could go. But whoever would like to go first, thinking about how did you know there was a problem that needed attention, that needed focus?
I could go first. We have the data about the maternity care outcomes here. We have the data from the AUA, for instance. We know that there is a cesarean section epidemic in our country. The cesarean section rates are coming close to 40% national. Some hospitals have crossed the 50% rate. One hospital had 67% rate of cesarean section. And we know from data from AUA that the driving force for these cesarean sections is monetary. We know that the natural birth is being paid 120,000 drams versus the cesarean section rate of compensation, which is 250,000 drams. So this gap in payment, and imagine one natural birth with an expectant management could go up to 1.5 days. And within that 1.5 day, doctors could perform multiple cesarean sections. Not only they're getting more compensation from the government, they also save time and they can do multiple cesareans. They also sometimes get some like շնորհակալություն փող from the families, right? Because they have done something more serious, like an operation. They saved the life of the mother and the baby. So there are so many motives to do cesarean versus natural birth. So some of you who are not coming from the medical background would ask rightfully, like, what's wrong with cesarean? It's saving lives. Yes, that's true. Cesareans can save lives, but abuse of cesarean section can cause a serious public health crisis. We know that cesarean sections have a tendency to yield 2 to 4 times more maternal death, hemorrhage, organ damage, anaphylaxis, and for the babies, it's not the best way to come to this world. The babies have more chances of dying from pneumonia and more diabetes. There was this cedar-cyanide study that showed that there is 58% elevated risk of getting diabetes and prediabetes later in life if the baby came through cesarean section. I mean, you name it. There is 14% higher risk of later pregnancy, stillbirth in future pregnancies when the woman has cesarean section. Secondary infertility, which is a big issue in our country. There is an elevated risk of secondary infertility, and for a country like us, having a serious issue. We know that the UNFPA has warned us that our birth rate has reached to an all-time low rate of 1.6 per family. So we're not reproducing ourselves. This is a serious demographic crisis that we're facing. And we have to understand that without a sustainable demographic security or sustainability, we cannot have a national security. When we talk about national security, we always think of the borders, the weapons, other kind of securities. But security starts from within. It starts from the Sustainable Population Fund, which we do not have. And all of the policies, all of the practices within the obstetrics are not promoting for a sustainable population growth. We're not even talking about growth. Keeping what we have, we need to have 2.1 rate of birth. We don't have that. 1.6, we don't even need enemies. We don't need enemies. We are our own enemies. And my work, when people are saying, you know, give your work, like describe your work in 2 words, I say, this is about national security. I'm here for the national security.
Thank you, Astrik, very much. That's an extremely important point, and I have many, many questions, and I'm sure you guys do as well, and maybe we can come back. But I think if we, so many questions, but let's keep going back to the question about the data.
Անդրադառնալով տվյալներին, ասեմ, որ անցած տարի Alzheimer-ի խնամք Հայաստան կազմակերպությունը Դավոսի Alzheimer-ի համագործակցության հետ համատեղ իրականացրեց առողջ ուղեղի հայկական ծրագիրը։ Էությունը կանում էր նրանում, որ Երևանում եւ մարզերում 40 եւ ավելի տարեկան անձանց հետազոտում էինք հիշողությունը, կոգնիտիվ ֆունկցիաները, ճանաչողություն, տեսողություն նաեւ, տարածական կողմնորոշվում, կարճատև հիշողություն, եւ մենք մեր մասնագետները, բժիշկները քննեցին 4400 անձի ամբողջ Հայաստանում եւ իսկապես մտահոգող, չասենք վախեցնող արդյունք ստացանք 35.7%-ը մարդկանց հետազոտություն անցածների այս կամ այն տեսակի կոգնիտիվ ֆունկցիայի խանգարում ունեին, որպեսզի ավելի պատկերավոր ասեմ, թե դա ինչ էր, դա իրականացվում Մոնրեալյան տեստի միջոցով, մոկա տեստի, մասնագետները գուցե գիտեն, շատ պատահող է, կարող եք ինտերնետում էլ տեսնել, նյարդաբանները մեր երկրում կիրառում են, աշխարհում շատ տարածված է եւ սա այն առաջին զգայուն տեստն է, որ ցույց է տալի մարդը խնդիրներ ունի, թե չէ, հատկապես կովիդից հետո շատերն ունեին եւ օրինակ պապիկի եղել է, որ մենք հարցրել ենք, ցույց ենք տվել ակնհայտ առուծի նկարն է, ակնհայտ, ոչինչ հետ հնարավոր չի էլի շփոթել բաշով բան, ու պապիկն ասում է, սա բադ չի, բալաջան, չէ, բադ չի, դե պատկերացեք այդ մարդը կենցաղում, կյանքում մենք հանկարծ հասկացանք, որ 35.7%-ը խնդիր ունի։ Այս ծրագրի երկրորդ մասով այս տարի առողջ ուղեղի հայկական ծրագրի երկրորդ ծրագրի շրջանակում մեր մասնագետները հատ առ հատ զանգում են այդ ընտանիքներ, այդ մարդկանց, որտեղ մենք տվյալները վերցրել էինք, մինչև այդ հարցաշար էին լրացրել Եվ տեղյակ են պահում ընտանիքի անդամներին, որ այսպիսի խնդիր կա, որտեղ իրենք մտածում են, թե իրենց տարեց ընտանիքի անդամը ուղղակի ծերացել է, բայց առողջ ծերացման եւ ծերունական թուլամության միջև հսկայական տարբերություն կա, եւ մենք հերթով այցելում ենք այս ընտանիքները։ Այս պահին մենք այս փուլում ենք, որ տեսնում ենք, թե ինչ իրավիճակում են մարդիկ, ինչի կարիք ունենք, մեր բազմաֆունկցիոնալների թիմը, սոցիալական աշխատող, հոգեբան, բուժքույր, խնամող, բժիշկ այցելում են այս մարդկանց ու այս առայցները բնականաբար անվճար են եւ կարող եք պատկերացնել, թե տարեց մարդուն Հայաստանում բժշկի տանելը ինչ դժվար է, ել չասեմ բժշկի այցը ինչ թանկարժեք է։ Եվ մենք մեր ֆիզիկական, այսպես ասած, վարժությունների մասնագետը Լիլիթը տնետուն գալասար այցելում է եւ այն ձեռքի վարժությունները, ֆիզիկական վարժությունները, որ անում է տարեց մարդկանց հետ, նրանց կյանքն է փոխում։ Դոկտոր Ջեյնի վերջի այցի ժամանակ ամերիկացի մասնագետ էր եկել եւ տանը առանց հատուկ գործիքների, նույնիսկ այդ ավելով, ոնց որ հատակը մաքրելու փայտի ցույց էր տալի, թե ինչ կարելի է անել, որպեսզի մարդը միևնույն է այս մարդկանց կյանքը այնքան է, ինչքան որ ոնց որ Աստված տվել է, բայց այդ կյանքը պիտի ապրել ոնց որ ոտքի վրա, ոնց որ ինչպես ասում եմ միտքը պայծառ եւ այսօր այդ 35.7%-ին հերթով կապվելով մենք արդեն մի քանի 100 ընտանիքի այցելել ենք եւ ծրագիրը շարունակական է լինելու, փորձելու ենք օգտակար լինել եւ օգտակար ենք լինում։ Շնորհակալություն։
Thank you so much. I'm just going to, before we move on, I just want to take the opportunity. Remember that you can send questions to us. I'm not just on social media or texting. I'm actually looking for questions. So please do send your questions. I think the barcode is up there. For those who are unfamiliar, your phone has a little button somewhere that you hold up and it captures it, and then suddenly you can send questions to this magical place, and then they will magically possibly come to me. I really like this approach. Let's keep going. If both of you or either of you want to keep talking about kind of the data, and what I love hearing so far is that there was baseline data. Love it. We know that there's a problem because I know in both cases, people had gone out and actually said, okay, we think there's a problem. Let's actually find out what it is and didn't make assumptions. So go ahead.
So I think in my case, it's a little different, or in a SafeYOU's case. There is obviously plenty of data worldwide about violence against women, about domestic violence, but what inspired our founder, Mariam Torosyan, to actually create SafeYOU, I want to tell the story because I think it's really important. She was actually pregnant in 2020 when she was creating before she had the idea to create the app, and she was at a family function. She was talking to a relative of hers, an elderly relative, and the relative said to her, "You're glowing, you must be having a boy, you look so beautiful." Because in Armenia, there's a saying that if you're beautiful in your pregnancy, you're having a boy, but if you're having a girl, she's kind of sucking the beauty out of you, which is crazy. And Mariam, like my founder, she said, "No, I'm having a girl." She already knew. And this woman, she was so upset, and she said to her, don't worry, like the next one will be a boy, it's okay. And so, I mean, it was there that she kind of had this realization of how do we keep bringing girls into this world that are undervalued, that are underappreciated. In Armenia, there's another saying, if he hits you, he loves you. I'm sure that some of you have heard of it before. So it's these kind of themes that were the, I guess, basis, the inspiration to create the SafeYOU solution, particularly in Armenia. There are other issues that we wanted to solve, such as the data gap on gender-based violence. So currently, only 13% of countries worldwide have a budget to actually collect data on violence against women in their country. And obviously, Armenia is not one of those countries that has a budget specifically to collect data on this issue. So we wanted to make data collection one of the core values of SafeYOU solution. So eventually we can kind of live in a world where we don't need SafeYOU anymore, where it can become a community space instead of an emergency app. So I guess obviously now, after almost 4 years of SafeYOU being live in Armenia, we've collected a lot of data. So we have, data on how many people trust the police as an emergency contact, how many people choose service providers as an emergency contact, how many people use the emergency button on the SafeYOU app. And I can go through all of that data for you, maybe now, maybe a bit later on, or if you have more questions about it. But I will add one more thing about data collection in Armenia and what also served as a basis for creating SafeYOU. I think 2019, I'm going to say, was the year that they did this study on how many cases were alerted to the police of domestic violence. I think it was around 2,000, 2,200. And then obviously we have helplines run by women's centers in Armenia that received over 5,000, 6,000 alerts on cases of violence. So there and then we know that government statistics aren't accurate. They're not painting the full picture. We know that violence is a family problem. We know that people won't talk about it here. We know that it's normal, it's intergenerational. It happened to your mum, it happened to your grandma, so it should happen to you. It's not a big deal. So these are the stigmas that we're trying to break and the data that we're trying to collect to solve this issue.
Wonderful.
And for us, we saw the situation with women's health during this 8-month program that we were running when we were helping pregnant women. And I think what I will say will be continuation of what Astrik was saying, because we have 700 participants in the project, pregnant women, where they deliver already, and more than 600 women they deliver through CS. And this is showing the situation that is running. At first I was thinking maybe this is because they were in a bad situation, where they were in a blockade, they were like running, going through difficulties, but seeing the whole picture in the country, this is also like some kind of proof what you were saying. And also I wanted to say about violence that you were saying. We face it also in our pregnant women, because abstract violence is also existing. And many of our pregnant women, they were going through, like all these women, I can say all the women, in like 700 pregnant women, and I can't imagine, I can remember a pregnant woman with whom I can speak, and she will say that she's not worried for the life of her child or her life. Every pregnant woman, every single woman was saying that I'm worried very much for the life of my child, because I went through scan and the doctor said that there's a problem. I think I will not go to the, like, I will not deliver at 38 weeks of pregnancy, which is the normal time to deliver. And they were like, I will deliver at 33, 34 because I'm weak, my child is weak. And this is about violence, I guess. This is what, and 700 women, it's data what I wanted to share with you, and like proving what you were saying actually. Like 700, 600 and more, like 90% of women, they went through CS. And as a pediatrician, I wanted to add that after CS, they were forced, I'm saying that, forced because they come back to me with already formula. I don't know why. Here, after CS, they are doctors. They don't allow women to continue breastfeeding, which is, I say, as a problem.
Thank you so much. I've gotten 2 questions that I'm going to kind of group together, so I'm not ignoring it. I'm going to come back to them because I want to integrate it into another question, which I was going to ask. The next question I'd like to bring to this group is the role of mental health. So I think in some spheres in Armenia, we have this experience where biomedical or physical health is medicine. And then there's social and mental health well-being, and never the twain shall meet. And I think since the war and since COVID and many other things, there's started to be more of a conversation between these two. And I'd like to hear from those who'd like to comment on it, what your experience has been, how you integrate it. Let's try to keep it to the point and brief, because there are really good questions coming in, and we have a lot of topics here. So go ahead.
The mental health is very much integral to our services. First of all, the Mom Center has pioneered a pilot project together, collaborating with the UNFPA, to create perinatal psychology curriculum that would go into the that would be delivered to UNFPA, and that UNFPA would then give this to the Ministry of Health, that would in its turn incorporate this into the maternity school programs in Armenia. And this is how they call it here. The childbirth preparation classes that we know in the West is called Mayrutsan Debrotsner. So the maternity school programs would then use our pilot project and our curriculum, and they will embed this in the childbirth preparation courses in future. That is one way we contributed to the perinatal psychology courses. And then another aspect of the mom centers psychological services is for Artsakhtsis. We started our services right at the beginning of the blockade. We employed an Artsakhtsi psychologist that would give ծննդաբերությունը արտակարգ իրավիճակներում, childbirth in emergency situations and breastfeeding in the emergency situations. So we employed someone on the ground to immediately, right within days, we jumped on this knowing that women are in panic. It's difficult to go through pregnancy, especially the first pregnancy, even without emergency situations. And imagine what was the state when women were calling to register. They were already hyperventilating and crying. So we figured that we have to start the services right there and then. And then after their forcible displacement, we started psychological services along with childbirth preparation and breastfeeding classes. And we delivered 70 courses for Artsakhtsis here in Armenia, in different marzes, and we're currently doing, continuing. So we have already done 70 courses, and we're continuing the work, and perhaps this project will go as long as it's needed. Yeah. Oh, I forgot. I have an addition. So these services are in Artsakh dialect. We have two Artsakhtsi psychologists, one for mothers and their families, and one for children, and they're very specialized in perinatal psychology and childhood psychology courses. Եվ Արցախի բարբառով են այս դասընթացները եւ շատ սիրված են մեր արցախցիների կողմից. Thank you.
Հոգեկան առողջության հետ կապված խնդիրները շատ սերտ են ցավոք դեմենցիայի հետ ու ինչ է տեղի ունենում մեր երկրում, քանի որ նախապես չեն իմանում, չեն զբաղվում մարդիկ, այն պահից, երբ որ հարազատները արդեն դիմում են մեզ, շատ հաճախ անձնավորությունը տարեց, արդեն ունենում է հոգեկան առողջության խնդիրներ։ Դոկտոր Ջեյնը մեզ միշտ ասում է, ախր դեմենցիան դա նյարդաբանի խնդիրն է, նյարդաբանի գործ է, ինչու են ձեր երկրում հոգեբուժները զբաղվում, ինչու, որովհետև արդեն բժշկի դիմում են, արդեն ընտանիքը դրա մասին բարձրաձայնում է, երբ որ շատ ուշ է եւ մարդու մոտ այս կամ այն տեսակի փսիխոտիկ երևույթներ են սկսված լինում, սա է շատ կարեւոր առնչություն հոգեկան առողջության, որ կարելի է դա կանխարգելել այդ կետին չհասնել եւ չպիտի որ հասնի, եւ մյուս բանը մեր երկրում այդ հարց կեսուր բանը որ կա չէ շատ տարածված գրեթե բոլոր ընտանիքում, իրականում երբ որ խորը նայում ենք այս խնդրին, սա պատճառն այն է, որ մարդիկ, տատիկները, կեսուրները, մայրիկները իրենք կյանքը չունեն, իրենք իրենց զբաղմունքը չունեն, իրենց այդ հոգեկան բավարարությունը ոչ միտեղ չեն ստանում։ Դա էլ պատճառ է դառնում, որ ետ գանտուն ու այդ չիրացված պոտենցիալը արդեն ոնց որ նեգատիվ երանգներով ընտանիքի վրա տարածվի։ Հենց երեք ինչ տեղի ունեցավ երեխաների օրներ, անգլիական այգում երեխաներին զբաղմունք կտա, նստեցի որ աշխատեմ, մի ծառին հենված, լավ անկյունային տեղ, որ ոնց որ շփումից բանից հեռու լինեմ, մեկ էլ թիկունքից զգացի ծանր շնչող մեկին, պատտվեմ տեսնեմ տատիկ, դե որ արդեն տեսա էլի ինչ հարցնում քանի տարեկան եք, 60 անց, թորնեն բերել էր զիփլայն ու պարտավոր էր որ նկարեր, դե ու ինքը դժվար, ասում ինչի՞ եք խոտին նստում, ասում դե ոնց նստեմ, սենց ինքը տանջված կին, այդ մեր հայ բոլորի տների, մեր մամաները, մեր ասում ախր ոնց որ ավելի ազատ տեղ եք, ամենայն դեպս այդ խորհրդային սերունդն էլ շատ կաղապարված, ասում դե ինչ հանեմ, բերել եմ, տեսեք, ինքը ասում է, այս անդադ ակտիվ եմ ապրում, դες ներկայացա, փորձում են ասում, ինչի՞ չեք գնում առողջ ծերության ակումբներ, նախարարությունը անում է ձեր թաղամասում։ Ինքը ասում է, ես անընդհատ զբաղված եմ, ասում, բայց զբաղված լինել ընտանեկան հոգսով, այդ պահածոները փակելով, թորնային հոգ տանելով, գործի գնալով, դա ձեր ժամանակը չի, դա հոգսերն են, դա ձեզ չի առողջացնում, դուք պիտի ունենաք օրվա մեջ, շաբաթվա, ամսվա մեջ ձեր ժամանակը, որ պիտի դուք թատրոն գնաք, առողջ ծերություն, ձեր ֆիզիկական ակտիվությամբ զբաղվեք, ու ասենց շատ ջերմ բաժանվեցինք, ես իրեն նաև մի քանի հարթակներ հուշեցի, արագ հեռախոսին միացրեցի, ասի ձեր կյանքում ոչ մի հանդիպում պատահական չի ու այդ կնոջը դեռ ճանապարհեցի այն բանով, որ ինքը հետո ինձ կգրի եւ ես կտեսնեմ արդյոք իր կյանքը որևէ տեսակ փոխվեց, իհարկե չաշխատեցի, բայց վստահ եմ, որ գոնե մի հոգու հոգեկան բավարարության, հոգեկան առողջության առումով մի քայլ արեցի եւ ինչ է ցույց տալի մեր հիշողության սրճարանի օրինակը, որ երբ որ չկա մի մարդ, որ եկել է հիշողության սրճարան, կին, տղամարդ, հատկապես կին, եւ դադարել է գալը, ավելի նրան գալիս են ընկերուհիներով, հորաքրոջ աղջիկներով, հարևաններով, որովհետեւ հասկանում են, որ այստեղ իրենք երջանկանում են, ժպտում են, նոր սոցիալական կապեր են հաստատում։
I'm going to do a mild shift because we're getting a lot of questions, and some of them are targeted and some of them aren't. And I'm sorry if we don't get to all of the questions. I'm sure I'm going to volunteer the panel to be available afterwards for questions. But there are a couple of very specific questions that I myself would also, I think, would like to hear the answer to, and I think a lot of people would as well. The first one is to Natalie, is how does the police department respond to calls related to domestic violence in Yerevan and in rural areas? And there are a lot of questions coming in, so I'm going to ask the speakers to keep it really to the point, and then if you have more specific questions, you can grab them afterwards.
No problem. I had a lot to add on the mental health topic, but I totally understand the timing.
If you can integrate it, that would be great.
I will try. In terms of police response to cases of domestic violence, I mean, we know how the laws are in this country, and there's actually been a lot of progress in terms of laws and police response to cases of domestic violence.
I'm going to interrupt you. Can you tell us about the laws?
Yes, so we actually, in 2018, implemented our first laws on domestic violence, except they were called family protection laws, as some of you might know. And essentially, if a woman is subject to domestic violence in her household, there's actually a 3-strike system in place with the police, depending on how severe the violence is. So in the first instance, if a woman is beaten and she calls the police, they come to the house and they serve a warning to the abuser, and then they leave. The second time, if it's the same case, the same family, the same couple, they will come to the house and they will expel the abuser from the house for 20 days. And then he's free to return. The third time, that's when eventually they will arrest him and they will take them to court. The first thing that the judge will ask in these cases of domestic violence, usually, I don't want to generalize, is, are you sure you can't work this out between you? Are you sure you can't get back together? This is something that we're trying, obviously, to work on. It's something that the civil society organizations in Armenia are doing amazing work on. Advocacy attempts are incredible at the moment. In terms of SafeYOU and how we work with the police, we actually have a really good working relationship with the police at the moment. We're working with them to actually upgrade their own internal systems and ensure that they can respond to cases more effectively, that they can sort them, and that they can actually receive SafeYOU alerts to their system. Something interesting to note is that actually in cases of people with disabilities, there's no easy way to contact the police. So a lot of communities and people with disabilities in Armenia use the SafeYOU app because they can't pick up the phone and call the police. If they have a hearing disability, a speech disability, it's really difficult. So we're working with the police to solve a lot of these issues. But what we do recommend to women and girls, if they've downloaded the SafeYOU app and if they're in an emergency, we recommend switching on the police function, alerting them if you're in danger, but also including an advocate in your emergency contacts. So that's a women's support center in your area. That way they can get on the phone, they can call the police, they can be like, are you responding to this case? What's the follow-up with the case? How has this happened? And this is something that we actually see working really well. So it's kind of, I guess, how the entire panel has been talking, a holistic approach. It's not just involving the police, it's involving the civil society, your family, your friends, ensuring that everyone receives that emergency alert and that everyone's involved and is able to follow up in these cases. At the moment, only about 22% of users of the SafeYOU app alert the police in cases of emergency. Majority of them only choose their family and friends. This comes back to that question of family, and it's a family issue of violence. They don't want... Actually, something that we've heard from the villagers, which I will share with you, is that a lot of women living in rural areas and in small villages don't want to alert the police because they don't want to hurt their husband's reputation in that village, which is, yes, a bit crazy. But that is how Armenia is. It's a small community. It's a country that everyone knows everyone and reputation matters. And even in cases of violence, it's the same. But, you know, I'll add one last thing. We often talk about bottom-up approaches to development and to issues like this, but working with the police from the top down has actually been really efficient and effective for us because at that top level, they're really open to change at the moment. They're really ready and willing to work with us and to train their own officers to react better in these situations. The laws are changing. Just a month ago, we've introduced new improvements to these laws. So yeah, that's what I'll say on the matter.
Thanks so much, Natalie. Did you want to make a comment, an additional comment on mental health?
I would love to. I just wanted to say really quickly, obviously when we talk about gender-based violence and domestic violence, it's not only physical violence. It's psychological violence, it's economic violence, it's every different aspect of violence that affects a woman's right to health and right to empowerment and to live freely. In the SafeYOU app, our forums with psychologists are the most popular. They receive hundreds of comments from women in Armenia, asking questions, sharing their stories. Women are very open on the app and very willing to engage with these professionals and receive advice and consultations. And I'll add one more thing. Actually, in 2021, we created a foundation. So SafeYOU is not just a social enterprise, but it's also a foundation because we realized we wanted to do more local projects in Armenia to help Armenian women and girls. So we run trauma-informed therapy sessions throughout the regions, a lot of them specifically targeting women from Artsakh, but also in general, women in vulnerable situations, women and girls with disabilities, a range of different women, and we work in small group sessions, and then we follow up with them through the SafeYOU app. So it's not just a one-off session. We have these 3 group sessions, and then they can download the app and continue to discuss with their therapist, with their psychologist from there.
Thank you. The following question is a very important one, and I think one of the last ones I'll take from what's coming to me, which is very difficult to choose, by the way, is for Astrik, and the question specifically is there obstetric violence in Armenia? And can you tell us what that means?
Okay. Well, obstetric violence, everyone heard about the domestic violence. Not enough is being spoken about the obstetric abuse and violence. Obstetric abuse and violence, these are expressions that are used interchangeably depending on the situation. But in a nutshell, it is the physical abuse, the emotional abuse or manipulation, and pharmacological abuse as well. Monetary abuse, mistreatment of women in general. So some organizations like the World Health Organization is using the mistreatment of women. Other organizations are using the obstetric violence term or obstetric abuse. Does this exist in Armenia? Yes, it does. And there are some reports. The EVN report specifically spoke about the obstetric violence, and women came forward to share their experience, to tell the truth. The entire film, the documentary, is about obstetric violence. That is why I did not have the desire to go to post-production, and I wanted to have a different ending. That is why I thought that maybe in time, with all of our efforts, we will have a different kind of picture, and we will finish this documentary with a better ending. But in terms of obstetric violence, I don't know if we should use this term in Armenia, because it's kind of difficult to tell the birth workers that whatever they're engaging is violence and abuse and manipulation. And it's hard to cooperate with the system while saying that because they feel or are labeled as perpetrators of this violence. But what do we want to accomplish here is not labeling them, not pointing our fingers, but collaborating with the system. And that is essential for our work. Otherwise, imagine the amount of mental dissonance of the practitioner, especially birth workers that work extremely hard and sometimes are underpaid, burned out, sleep deprived, and then you come from the West and call them people that are engaging in violence. So we have to be very sensitive about their sensibilities, but yet we have to also hear what women are saying about their stories, and we have to create this bridge and the conversation between the mothers, the birth workers, and the administration to address this.
Thank you. I know it's a very difficult question, and I think what you're describing and what a lot of the folks on this stage here do is they walk a very fine line between wanting to protect, advocate, change, but also understand the situation and why things are the way they are, and not assume that we know why or how, but really to make it better for everybody. We have about 5 minutes left, and I'd like to start on this end. And I'd like, if you can, starting on this end, and maybe if we have time, go through everybody, but say, we have a very diverse group here, like from all over the world, as we heard. What is it that you would like to impart to this audience? What idea can they walk away with that you think maybe they didn't have before about the type of work or strategy or thinking, or if you are thinking about how resources can best be used, what does that mean in your situation? Because, and I'm just going to throw this in, I think we are a nation that is all over the world. We have been, as a nation, through lots of trauma, which we have not processed, and the type of support that we have tried to give as a diaspora to Armenia is evolving. And it needs to evolve further, and that evolution is long overdue, I would say. That's my little bit. And so when you think about how, if you had limitless resources, what would that look like? What could you do? I know I'm asking a lot of questions, but I'm just trying to give you a broad swath to work with. What would you do? What is it that you need?
After all this experience we had, the important thing that I understand that we need education. We need to educate girls, and from the young age, from school. It is very important. Girls have to grow up confident, because a lot of public opinion is affecting them, and also confidence is very important for them to make decisions. And education for young girls from the school, and education for the doctors. We need that also. We need to promote programs for breastfeeding. I speak for pediatric side. We have to promote that. We have programs, but we need more programs for breastfeeding. And actually, this is the most important things that I want to share with you, that I understand that education is really important. Thank you.
I think one thing that I want to leave the audience with, I've been talking a lot about the situation in Armenia and how it's a little dire, obviously, and there's a lot of instances of violence and a lot of stigma. But I want to emphasize that we can't look from the outside in on the situation of domestic violence or gender-based violence in Armenia in any sort of judgment or in any sort of, oh, look at Armenia, like they're struggling with this issue, because I've come from Australia where one woman every week is killed because of a case of domestic violence or gender-based violence. So extremely global issue, highly contextual to every country, and every country is dealing with their own problems in regards to this. Armenia obviously is dealing with this set of issues, but every other country, wherever you're from in the world, this issue is very, very serious and is not going away anytime soon. So yeah, just to be reflective on how we approach this situation in Armenia as opposed to where you're from in the diaspora. And if there's one thing I can ask from you all, if you want to help SafeYOU, our plan is for SafeYOU to be available in every country all over the world. So for women and girls to have access to this solution, no matter where they're from. And what we can ask from you is your network. So if you know of women's organizations in your home countries, if you know of government officials, other important individuals that could help us expand the SafeYOU solution to a new country, a new context, please let me know. We can talk about it after the panel. I really appreciate it. Right now, we're expanding into Eastern Europe, but we're also working on our US expansion. So yeah, we highly value connections and a network because that's what SafeYOU is built on. Thank you.
Խոսելով կրթության մասին, որ կուզեի, որ բոլորն իմանան, մենք Alzheimer-ի խնամք Հայաստանը առաջին անգամ Հայաստանում սկսեց մեդիա նախագիծ, այսինքն հեռուստատեսային մի պրոդուկտ, որ նախատեսված էր հենց տարեցների համար, միայն 60 եւ ավելի տարեկանների համար։ Այդ պրոյեկտը համին շատ սիրելի է, որովհետեւ ինքը իմ պրոյեկտն է, նաև իմ գաղափարն է դոկտոր Ջենի հետ, կոչվում է Second Start Armenia եւ երկրորդ շնչառություն հայերեն, երբ որ թարգմանում էինք, ասացինք ոնց անենք երկրորդ շնչառությունը, եղավ Second Bread, դոկտոր Ջեն ասաց Օֆելիա, այդ շատ տխուր է, մի բան մտածի անգլերեն, մենք դրեցինք Second Start Armenia, ես խնդրում եմ, որ բոլորդ YouTube-ում, Instagram-ում, TikTok-ում ամենտեղ տարել ենք այդ պրոյեկտը, որ տատիկները, պապիկները լսեն առողջ ծերացման բանաձևերը եւ հատկապես Սփյուռքի մարդիկ, որոնց ծնողները շատ հաճախ հայախոս են, հայերեն են հասկանում, հայերեն են ուզում այս բովանդակությունը, այս կոնտենտը թող միանան, լսեն, գրեն, հետաքրքրող թեմաներ, բժիշկներ, եթե ուզում են, մենք այնտեղ ցույց ենք տալիս success story-ներ, տարիքով մարդիկ 100 տարեկան, որ նախանձելի կյանքով են ապրում, հավատացեք նախանձելի ու այդ օրինակները մեր շուրջ են, հատուկ են, բայց կան, եւ ինչն էր ամենակարևորը մեր հիշողության սրճարաններում, որպեսզի արդյունավետ աշխատեն, պիտի 15 հոգի լինի, մենք արդեն վաղուց 20-ն ենք, մեր սոցիալական աշխատող Մարիամը ծիծաղում, որովհետև ինքն է այդ մոդերատորը, եթե ունենայինք ավելի ֆինանսավորում, մենք կկարողանայինք երկրորդ օրն ունենալ այդ մեր waiting list-ը կկրճատվեր, եւ Գյումրիում էլ չեմ ասում, որ Իջևանի լոֆտում ենք այդ նախատեսում ուզում ենք ունենանք այդ ծերության ակումբ ասվածը հիշողության, սա էլ կարող է օգնություն լինել մեզ համար, Սփյուռքի մեր բարեկամներից եւ ընդհանրապես ով ունի հնարավորություն կամ թեկուզ ծնողների հիշատակի համար կամ որևէ ձևով։ Շնորհակալ եմ։
Շատ շնորհակալություն. We have 1 minute left.
Okay. So for people who are locals, young girls who are in their reproductive age, I would say, please take charge of your birth. Educate yourselves. Become your own agency. Take that agency. Take that right to create your own birth plan. Ask hundreds of questions to your birth provider. Don't just, give in yourself. Don't just say, the doctor, just deliver my baby. Babies are not pizzas to be delivered. You birth your own baby. And for people who are from abroad, please do pay attention on prevention and education. We are constantly bombarded with different emergencies. I understand that. But if we plan better, if we strategize, we'll put our money in prevention, because late treatment is already too late, too costly, too ineffective. And organizations like us, like the Mom Center, who is doing education in preventative care, I think that this is the best investment of your money. Put the money in the prevention, in the education. I would love to have mom centers all over the country. There are 56 birth centers, and I would love to have mom centers all over, or at least be a consulting body to this Mայրության դպրոցներ, where they're teaching the women how to get cesarean sections or epidurals. We would instead teach how to have physiologic, normal, safe, and respectful birth. That's what I would want.
So, just to wrap this up, but before I get another message telling me that we're out of time, I want to first of all thank everyone for coming and sharing your experiences and all of your work, which is amazing. And I think one of the things we can walk away from here is that there is a lot of work to be done. There are very motivated, dedicated people looking at where the problems are, how they can be solved, collaborating. We didn't even get to that. Collaborating amongst each other, asking the right questions, and trying to make an impact not just on individuals and communities, but on the system itself. And I think that is something that we really need to think about as somebody who bridges Armenia and the diaspora, is we want the work and the resources to go towards building systems and not just, let's say, buildings or small projects that become larger projects, that become larger, that change entire systems, so that we can have a healthier woman and a healthier nation. Thank you.